call both cases mild, but this time around I did feel a little bit sicker.
She is a Valley doctor who contracted COVID-19 not once, but twice. Channel 5's John Paul Barajas first spoke to her back in April. He's back with her new warning.
And apparently this is rare, but it's possible.
Dr. Martha Gano is fighting off the coronavirus for the second time. She tested positive in April. Before returning to work, she had to receive back-to-back negative results, but she also received negative results for the antibodies that would protect her from another infection.
One evening, again, I developed fever and chills, and then a severe headache the next day. I thought, this can't be happening again.
It did. Her results were positive just a few weeks ago in June. Luckily for her, she hopes to be declared COVID-free again in just a few days.
I would call both cases mild, but this time around I did feel a little bit sicker, and my recovery is taking a little bit longer, but I'm feeling well.
It seems the virus is affecting everyone differently, from no symptoms to mild symptoms to severe. In the case of antibodies or temporary immunity, the timetable varies, or in Gano's case, never existed.
And it may have something to do with the severity of the disease. People who have a more severe course of illness are more likely to develop antibodies.
Although this is her second round with COVID, she says she's been lucky. She considers the fact that her two sons have remained COVID-free throughout this a blessing.
How is your family dealing with this?
So the hardest part is being away from them. The hardest part is not seeing them, every day. Because of COVID, I've lost essentially, 2 months of 2020 with my children.
Gano adds, even if you've beaten COVID, it's not time to relax, and you shouldn't let your guard down. John Paul Barajas, Channel 5 News at 6.
That's her personal experience. As for her professional experience,
can you tell us how much different or how much worse
Right.
from last peak to this peak?
It's an extremely drastic difference. It's an exponential difference. As of Friday, there was 123 COVID patients at McAllen Medical Center in a 440-bed hospital. That's over 25.
Dr. Gano says COVID patients are currently taking up 2 floors at McAllen Medical. The virus first emerged in the Valley back in March. The doctor says between now and then, hospital administrators were able to stock up on protective gear and prepare those COVID units.